Hello, and welcome to another edition of Ed Talks. So, the issue that I want to address today is the ongoing confusion between general anesthesia and sedation. Why this is important. Oftentimes, a patient comes in and they will tell the anesthesia provider that they were awake for their last surgery. And oftentimes they'll say that they were awake or that they remember parts of their colonoscopy or usually some other minor procedure. And therein lies the crux of the confusion. General anesthesia is generally only used for very large and long procedures, whereas sedation is commonly used for very short or simple procedures. General anesthesia almost always leads to memory loss about the surgery, and generally the patients will have no recollection at all of the surgery because general anesthesia is that deep. Only on very rare occasions does a person actually have some recollection under general anesthesia. Sedation, however, is a different animal altogether. Sedation really just means that the person is going to be very groggy for the procedure. Their consciousness may wax and wane during the procedure. They may or may not move during the procedure. It is not general anesthesia. And because of that, we cannot guarantee that the person getting sedation will not remember or see different parts of their procedure. Having said that, 9 times out of 10, most patients don't have a recollection, but if they do, that is actually not an issue because sedation in and of itself does not prevent recollection. So, if you've had a small procedure, such as a colonoscopy or a mole removal or something like that with sedation, you cannot hold it to the same standards that you would hold general anesthesia. So, before mentioning that you had a recall or that you remembered something from your experience, you may need to understand whether or not you had gotten general anesthesia. If you had received general anesthesia and you have recollection, then you have true anesthesia awareness. However, if you just had sedation, then it is not true awareness. You may ask whoever's going to give you anesthesia to bear that in mind. They can tweak the sedation probably a little bit more so that it decreases the chances of you remembering anything, but we cannot completely guarantee that you won't. And anyone that does is not being completely truthful. That's it for now.